So let's talk about hospitals. Hospitals are different from physicians, kind of obviously. We're talking about organizations rather than professionals now. Hospitals are organizations that provide facilities and staff to offer medical care. Hospitals can operate as private businesses on a for-profit basis or sometimes on a not-for-profit basis. And sometimes hospitals are owned or operated by government organizations, and then we might call them public hospitals. Most of the general lessons about hospitals can apply in both the public and the private case. There's quite a bit of variety in hospitals, with hospitals providing lots of different kinds of services, lots of different kinds of facilities. The defining characteristic really of a hospital is the provision of the beds and the infrastructure for inpatient care. If an organization doesn't have that, then we would not normally call it a hospital. In addition, though, many hospitals also have other facilities, often for outpatient care. Many hospitals operate an emergency department, for example, to handle emergencies and other urgent matters. And lots of hospitals also operate other facilities, like maybe a same-day ambulatory surgery facility, or lab or imaging facilities, maybe facilities for outpatient physician consultations. Now, there are some important dimensions on which hospitals vary. We can call out a few of them here, the ones that come up more often. First, hospitals can vary in the level of services they provide, from more basic to more advanced and all the way up to tertiary or quaternary care. Most hospitals will provide standard beds for patients needing what might be viewed as more routine inpatient care, including both medical and surgical care. Most will also operate an emergency department. Those are sort of basic things for hospitals. Many hospitals will then also offer what we call intensive care units or intensive care beds for patients with more severe conditions needing a higher level of available equipment, higher level of professional attention. And as they get even more advanced and even larger, they might add also facilities for more sophisticated surgeries, more sophisticated testing, specialized units within the hospital, for example, a specialized burn unit to take care of patients with severe burns, or a cardiac care specialty unit, maybe a trauma center for particularly serious emergencies, that kind of thing. Reaching the end of the continuum here, you get some really big referral centers with the most advanced and the most specialized capabilities. A second dimension on which hospitals vary is the focus of the hospital. Most hospitals are set up to treat a broad range of types of patients and cases. We sometimes say general hospitals for these kinds of hospitals. But you'll also find hospitals that specialize in particular areas, like, for example, children's hospitals for pediatric conditions, psychiatric hospitals, or rehabilitation hospitals, or other focuses. Many hospitals focus on patients needing short-term care, like a few days or a few weeks in the hospital. But some hospitals focus on patients needing long-term care, so you'll see that variation. And teaching is another dimension. Some hospitals operate programs to help train new doctors, and we refer to them as teaching hospitals. Sometimes we identify hospitals with a strong association with a medical school as academic hospitals. Hospitals not only provide the infrastructure needed for inpatient care, but they also hire many kinds of professional staff to aid in the production of that. A lot of these are people who provide care within the hospital. Nurses, for example, are commonly hired by hospitals and very important for hospital care. Also many others, nutritionists, pharmacists, x-ray technicians, rehabilitation specialists, just to name a few. Hospitals will also generally hire business personnel for administration, finance, IT, human resources, management, a bunch of other related things. So we have this variety of organizations out there providing lots of different services, doing lots of different kinds of things. And we have to see them in this complex context in which they operate. They're trying to provide great medical care. They're trying to act as businesses, meet the bottom line so they can stay in business and keep offering the services that they want to offer. So we have to take a look at the factors that affect them and the world in which they operate.